Hi, my name is Carrie. I'm reflecting on a real life experience of effective communication. I did not have to reflect far. In my work environment, we have many different roles that are filled by different specialties and management. At one time, we will be a member of the team that is called to lead, and that at other time, we will be called to follow. A lot of times, it feels like both. The incident of communication that I'm recalling was working with a patient who is positive for COVID-19. Within our hospital setting, all of our positive patients cannot receive visitors. And as a caregiver for these patients, we are also the conduit for communication between the medical providers, the different specialties, and the families. A common theme played that is relayed from the patient's caregiver is that they do not have updates from the physicians regarding the care of their loved ones. As a member of this healthcare team, it is important for me to remember the goal is to identify a way to effectively solve the problem presented, which is for the family to get the communication that they need and deserve without losing faith in their physicians. So in this scenario, I view myself as a team member and the physician as the leader. And yesterday, the patient's daughter, who was the healthcare proxy, received a phone call from the palliative care team. And the palliative care had been consulted by the primary care team. So she was unable to speak with the palliative care physician and only received a phone call regarding the consult for her father. During her phone call to me, she was very angry at the fact that she had researched palliative care and found that it involved end-of-life decisions. She was not under the impression that they were at that point with her father's care. She was angry about the lack of communication and the phone calls, lack of phone calls that she had been receiving with updates about her father. So my role was to enable my leader, and as a nurse, it is my physician, to create a positive outcome where the patient's family feels educated, updated, and included in the plan of care for the patient. My role was to build up and turn around the poor perception of care and communication and have a positive result. My first response was to listen to the frustrations of the healthcare proxy. Being unable to come and see the patients does rob the families of a complete picture of how the patient is doing. The in-person visual is significant to understand how critically ill the patient is. Many times the family has last seen the patient in their normal state of health, and it's quite a different visual picture than where the patient is now. Frustration, denial, and anger are common emotions for the patient's families, and they are usually directed at the healthcare providers and do nothing to help the communication or install confidence that the patient is receiving the best care. After listening, my role as a leader to the patient's family and a follower in the healthcare team was to seek to solve the problem of communication and distrust by expediting conversations with the proxy and the physicians. In doing so, I'm always sympathetic to what the family is going through without disrespecting the healthcare givers. By presenting all the care, testing, and medications that are being given to the patient, I can present the family with a complimentary picture of the expertise and hard work being done by the physician. And then finally, as a way to solve the problem of communication, I formulate a plan with the patient's proxy to have a conversation with the physician about the patient's care, giving the patient's proxy a time frame for follow-up that is realistic in view of how busy the physician's day is, can be helpful to the family so they know when to and what to expect. They know that they might have to wait for the physician to be free later in the day to make a phone call to them. And then the last task is to communicate to the physician the conversation, the concerns, and the plan that's been formulated with the patient's healthcare proxy by giving them a phone number, reminding them of the family's expectation for communication, and what was agreed upon allows the physician the freedom to complete the task when they have the time. Then the goal is complete. The goal is complete of complementing the physician's skills to the family and cultivating trust between the family and the caregiver.